One of the areas, of course, that people don't enjoy about dentistry, and which has gotten a rather bad rap over the years, is root canal therapy treatment. A root canal therapy treatment is where the nerve in the tooth has to be treated because it has become infected, inflamed, or has died, or for a variety of reasons. Now, in the past, yes, this was an uncomfortable procedure, and it was as soon as you would say to someone root canal therapy, you could see their fear levels rising quite dramatically. We do quite a lot of root canal therapy treatment here, and we do it with the most modern materials and techniques available. And this particular unit that we use, that we have here, is the latest incarnation of those treatment developments. What this allows us to do is to do your root canal therapy treatment, if you need that of course, your root canal therapy treatment in a much more precise, much less painful, much more comfortable way, with superb results in a much shorter time frame than what we were able to do in the past. What this does is, instead of us having to use these little hand files to try and clean out the nerve canals in your tooth, and at great, which took a lot of time and a lot of effort, we can use these little rotary devices. So they're like a little drill, but they are a nickel titanium drill, and there's an example of one there. And the system that we use here is called the Wave 1 system. And what this does is that instead of us having to use little hand files to clean out the canal, this, with a special drill that is attached on here, and it just rotates clockwise a certain amount, and then it counter rotates, and it goes in a very, very precise way so that we don't have any problems. But it's a highly, highly flexible tip. This nickel titanium is highly flexible, so it can follow any of the canal curves that might be in your tooth, and it works superbly well. And it's, from your point of view as a patient, it's quick and efficient and comfortable. These little files, these rotary files that we use, you need to be aware that we only use them for you once, okay? Once for one patient. So as soon as that file is used on you, it's thrown away. It's never used again. And that allows us to make sure that, of course, infection control is superb, but also it means that the risk of any problems occurring with these little fellows breaking or anything like that is absolutely minimised. The nickel titanium files, the drills if you want, are extremely good and extremely flexible. But if you autoclave them, if you sterilise them, they become a little bit more brittle, and they're a little bit more likely to break in a subsequent usage. So our policy, our practice is we never reuse them again. Once we've used it for you, it's thrown away in our sharps bin and will never be used again.